Hi, everyone. It's Dr. Paul from the East Ontario Health Unit with your weekly update for COVID. And today is July already, July 6th, 2022. So I'm going to start as usual with just sharing my screen and looking at some of the local statistics. And as you may have heard, there is a bit of an uptick in cases, not only locally, but also provincially. And our hospitalizations have gone up. Now we're up to 8 hospitalizations, 5 of which are in the ICU. So that's kind of a big increase that we've had, in terms of ICU numbers and cases in hospitals. So you can see kind of here the number of the ICU going up. Again, we're going to keep a close eye on it. We do not anticipate that this is going to be a big wave. This is a small wave, a wavelet, we're calling it. We're just looking at that, and I'll talk about what we can do to make sure that it remains a low wave collectively. If we're looking at our positivity, that too has gone up a bit, but I can tell you that it's much less than the provincial average and certainly much less than Ottawa. So you could see we kind of were low here, then we went up. Now we're about 7%. We had gone down to about 4.9%. So again, we're seeing a bit of an uptick in that. We're also seeing an increase in wastewater, and I'll show that to you in my next my next set of slides. But before I do that, I just want to talk about our institutional outbreaks. And again, we're up to 8 right now. And again, you could see sort of the up and down, up and down, up and down. Again, we're going to keep an eye on that. In terms of the numbers, again, it's a total of 17 staff and 39 residents among the 8. So it's not that many per, but you could see that we're this slightly going up. And again, this is consistent with what we're seeing across the province. I think it's just a sign of a small wave coming, which is something that, we're always on the lookout for. We do not think it's going to be a large wave, but again, we want to keep an eye on it. We've had no changes in deaths, thankfully, since last time I reported it to you. So then you could see sort of last week we were, we were a bit better, but they were creeping upwards, and I will talk about the wastewater in a second. And so it's to me, it's just important to talk about, where we are and what we can expect and so on. So I'm just going to now show you some kind of the provincial data, which basically shows the common thread that we've had locally as well. So there's been an increase in the case numbers week to week as compared to a couple of weeks ago. There's been no change in deaths. So thankfully, despite the cases going up, the deaths have not increased. Positivity has gone up. And again, you can see our average is 5.4, rolling average. It's a bit higher, but you can see that the positivity is up now provincially. Number of outbreaks has increased as well, as has ours locally. Hospitalizations have started to increase a bit, again, compared to a couple of weeks ago. And ICU is a bit up, but it's kind of stable. But again, we're keeping an eye on that. So it's kind of reflective of what we're seeing at the local level. If we want to compare right now, sort of what's going on worldwide, I just want to give you some context now. You could see that most of the countries, New Zealand, Australia, France, Israel, Germany, Italy, Spain, are having large increases for the most part here. US is a bit up. You could see Quebec and Ontario, slight increases, so not as steep as they are as well. We're seeing some other countries in other areas where you got a bit of a decrease. In Portugal, for example, was quite high. Again, most of these are driven by the BA5 subvariant of Omicron. And so if we're looking at sort of the health units themselves, we could see as well that most of the health units have had a small increase. You can see us here, we went up a bit, but sort of slow, steep is not as steep. It's sort of a flatter curve upwards, whereas you can see only a handful have had a decrease. And for example, here the Northwestern started very high going down. So again, a slight increase across the board for the most part. And you could see here our numbers of 31. We were lower than that last week in terms of the numbers per 100,000 per week. And speaking of wastewater, I want to show our local levels. Our website will be updated this morning. We just got this data last night. This was reflective up until last week. And you could see that this is Castleman is kind of stabilized. For Hawkesbury, again, it went up a bit and kind of stabilized down, but you could see a bit of an uptick here in Cornwall. And that's not dissimilar to what we're seeing across the province. And for example, in Toronto, it's going a bit up but flat. Ontario, it's a bit up but flat. East, again, is going up a bit. Northeast is kind of flattening down. Northwest is flattening. So you could see slight tendency upwards, not a steep one, but you could see it going upwards. So that's something that we need to keep an eye on. The percent positivity, again, is starting to increase across the province. And for the most part, most of the health units do have increases in their positivity, with Ottawa being the highest right now. They're about almost 17, 18%. We're among the lower ones in terms of increase. But again, you could see a week-to-week increase in those numbers. And finally, once again, I just want to show kind of the rates of death and ICU admissions. And the red is not vaccinated. And you could see there are much higher rates for cases, much higher rates for hospitalizations, much higher rates for ICU admissions, particularly among the older. It really, it's the 60s, 70s, and 80s, predominantly 70s and 80s. And that's why we're trying to protect that population as much as we can. And so that just shows us again that the vaccines do work. Yet, we can get, you may get a case by being vaccinated, but otherwise you will be protected against hospitalization and severe disease. So I want to go back now, and I want to share my screen again, where I'm going to be looking at our vaccines, because I want to finish off today's update with sort of a messaging of vaccines and how important they're going to be over the next couple of weeks into the fall. And so if we look at our vaccine administration here, we can see again that we're kind of flattened in terms of the fourth doses. We're now at almost 60% fourth dose to the 89s. We're less than that. We're 44%, 70 to 79, and we're quite low at 24%. 60 to 69. Now, this is the reason we asked, we were recommending fourth doses to this age group, is because this is the age group in which the third dose vaccine eventually starts to wane off, decrease its efficacy, and you start getting breakthrough infections. And we knew that there was going to be ups and downs over the summer. And this is why we wanted to protect this population, because this is the population that ends up in hospital, ends up in the ICU, and ends up dying. And so we need to get, in this particular population here, we need to get the fourth doses up to the high levels to optimally protect them. And then you can also see, and for people less than 60, you can see again, the rates of third dose are 59% in the 50-year-olds age group, and then they go down 49%, 40 to 49, 42%, 31%, and then 12 to 17, it's 11%. And so, we need to be able to increase the third dose as much as possible in this population. And if you're 12 and above, you are, like, we're not talking about boosters anymore. We're talking about, or fully vaccinated. We're talking about being up to date. So as of today, if you're between 12 and 60 years of age, in order for you to be up to date, you need 3 vaccinations, 3 shots. And so the third shot gives you much higher protection than the second shot, which is wearing off. And that's why we're seeing now a lot of this age group here, younger age groups, getting COVID cases right now, because their second dose is weaning off. We need to boost that up to give the third dose level. We're really, if you're looking at 18 plus population and overall population, we're about 53% third dose. We need to, that almost half of the population needs their third dose, right? And then, because a lot of people have been asking us, why can't we get fourth dose as well? You know what? This population hasn't even gone high up in the third doses. We need to give those third doses before we roll out the fourth doses. Now, having said that, in terms of what we are expecting, yes, there are now plans to look at the fall. There are recommendations that we need to give another shot. So if you've had a second shot, you need a third shot 6 months after your second shot. If you had your third shot, you need your fourth shot 6 months after that, and so on, depending on your age group, 60 plus. So we're looking at that, and we're planning for vaccination strategy into the fall. But in the meantime, even though the fourth dose may or may not be made available to younger individuals, you can see that I showed you that most of the younger individuals have not even received the third dose. So and that's available to that age group, and that's available at the health unit. That's available at all pharmacies, readily available. We have plenty of vaccine, and so please go and get the third shot, because that's going to be one of the factors that will help us dampen that wave that I was telling you about, that we're starting to see the increase. So that's going to be very important. And then obviously we're going to be looking at fourth dose strategy into the fall. But again, as you saw, the minority of our people that are 60 plus have received their fourth dose. So we still have some work to do, and those are eligible right now. So that 60 plus can get their fourth dose, and the individuals less than that who have not received the third dose can obviously go and get the third dose, and should get that, because that combined increased protection will help us over the next couple of weeks into the fall. And the other thing too, in terms of what we're waiting for, is there would likely be in the fall, I'm not sure when, October or so, an Omicron vaccine that has activity against Omicron. So we're looking forward to that. So again, the fourth dose, when it opens up, may be that one for the rest of the population, and perhaps the 60 plus who've got their fourth dose would require that booster, which would contain the Omicron. But again, that's not out yet. But for now, it's very clear that our strategy is to ensure that, of course, we continue the public health measures, wearing masks indoors in public settings, if you're vulnerable, if you're not comfortable, if you're with vulnerable individuals. But again, importantly, we need to get the numbers up of the third dose. The third dose will offer a protection that's much higher than and longer in duration as compared to the second dose. And the other thing that the third dose does is that when you're third dose vaccinated, it seems that even if you do get a breakthrough, you'll get mild infection, but you will not be as contagious as you would have been if you had 2 doses or less. And so that's very important as well. And the other thing that we're also seeing is that in terms of long haul, it seems that the more doses one gets, the less chances that an individual will develop long haul complications if they do get COVID. So there's many good reasons for us to continue doing that. We want to continue to have a nice summer. We want to continue to again, not unexpected to have sort of the ups and downs. We're hoping that we'll get a bit of a plateau very quickly and then go back down and then prepare for the fall. So once again, thank you for your cooperation and all you do. Remember those basic public health measures, washing your hands, not going out when you're sick, and wearing your mask in indoor places, or if they're crowded face-to-face, even outdoors, if there's prolonged contact face-to-face in crowds, please consider wearing a mask. Thanks again, and I'll see you next week.